Hi, good evening. I'm Therese Dyer, the AARP Statewide Advocacy Lead, and I want to welcome you to this important discussion about family resources for family caregivers here in Ohio. This evening, during our coffee shop conversation, we're going to talk with experts about resources for family caregivers. My co-host and I, Ernestine Jackson, the Central Ohio volunteer lead and executive council member, want to thank you for participating in this conversation this evening. More and more families find themselves becoming caregivers or in need of some support themselves. So we're going to start with what it means to be a caregiver, give you some information about long-term care, and some simple steps. We want you to get your bearings, educate you on what are those terms like long-term supports and services, and provide you the resources to help navigate a new situation that you might find yourself in. So this is just a large topic with a lot to cover in just one conversation. And our hope is that you learn from the experts that we have tonight the information you need as a caregiver while still discovering the joy being a family caregiver can bring. So now I'd like to introduce one of our guests. We have brought together Susan Reinhard and Amy Goyer, who are going to be with us tonight. And they're going to help get you the right help at the right time. Okay, so Susan Reinhard. Susan Reinhard is a senior vice president at AARP, directing its Public Policy Institute, the focal point for public policy research and analysis at the state, federal, and international levels. She leads PPI's family caregiving initiatives and also serves as the chief strategist for the Center to Champion Nursing in America, a national resource center created to ensure that America has the highly skilled nurses it needs to provide care in the future. Susan is a nationally recognized expert in health and long-term care policy with extensive experience in conducting, directing, and translating research into action to promote policy change. Susan oversees PPI teams working on health security, financial security, and family, home, and community issues, and from that vantage point serves as editor-in-chief of Policy Plus Action, the AARP Public Policy Institute newsletter. Previously, she served as professor and co-director of the Rutgers Center for State Health Policy, where she directed several national initiatives with states to help people of all ages with disabilities live in their communities.
Hello. Hello. Can you see me? Hi. So thank you for that very generous introduction. The most important thing we probably didn't put in there is that I lived in Ohio for a couple of years while I was getting my graduate degree in nursing. And that was at the University of Cincinnati. So we still have friends in Ohio. And I have a very, very warm place in my heart for people who live in Ohio.
That's great. That's great. So I wanted to say to you, as I was encouraging people to join in this conversation, I was questioned a lot about, what do you mean when you say caregiver? I'm taking care of my father and my mother, but I hear that word a lot. What does that really mean? So maybe that's a jumping off point for us this evening.
Yeah. You know, it's interesting. I've been doing this kind of work for a long time. I was a visiting nurse and I would, ring the doorbell to visit someone, and who would answer the door? Well, most likely it was a family member or a neighbor or a friend who was there helping somebody take care of somebody. And I'm sure they never consider themselves a caregiver, right? They would say, I am his wife, his daughter, I am the next door neighbor, I am a friend or whatever. But we need some term to use, I guess. And when we are doing research and policy and legislation, but we always have to explain it to everyone that what it means is that you are someone who is giving care usually unpaid. Like you're not getting paid for this care, but you could also be getting paid. You're a family caregiver, and you are doing things that are a little over the top of what you would normally expect, right? So you might expect to, I'm just making this up. You might expect in your particular role that you would make dinner, or you would go shopping, or you would take somebody to the doctor's office or the nurse practitioner's office. But it starts to get more when you are really spending a lot of your time doing different things, especially when you get to, like I call it medical nursing care tasks, like things that nurses typically did,
Yeah.
but also bathing and dressing and feeding and helping people move around in the house and get in and out of cars. That's like not what you would expect to do normally. That's when you are, I think, this is my simple definition, when you're doing more than most would expect that you would do in your role, then you're moving into family caregiving, so to
Yeah.
speak. And I
So,
want to say that varies by culture. Some people will never think that they are a
that's
family
right.
caregiver.
Yeah,
Yeah,
that's true.
but so it does vary.
I'm a big advocacy fan in many different areas. And so I'm impressed with your background and your work. I think what I'd like to know is what are the kinds of things that we can do to advocate for better support for caregivers?
Well, here's the good news. The really good news is that years and years ago, when I was first getting more involved in research and policy in family caregiving, people didn't know what I was talking about. Like, what
Yeah.
does that mean? Right.
Yes.
But
Yes.
now, because more and more people are involved, I mean, we've got close to 50 million family caregivers. Uh, Again, neighbors, friends, family members, that chances are you could be talking to a legislator who is a family caregiver. We have governors that are family caregivers. Like they get it. They have an experience in this themselves.
Right.
They have other people they know that are doing this. They may not know everything you're doing, but they don't have to be. It doesn't take people long to listen to what you're saying. So I think the most important thing is working together like you are, right? You're working at AARP in Ohio. You're pulling together different people who have these experiences. And then you talk about, well, what is it we want to try to advance? You know, what is it? Is it more money for respite care, which is like taking a break? What are the things you want to prioritize? And then you tell your story. Legislators want to know the stories of people who vote for them, right?
Yes. Yes.
So you don't have to have a lot of data and a lot of sophistication. It's more like I am your constituent and I have this need and I am working with others that also
Right.
have this need.
Right. And that kind of takes one of the things I think that is important right now is how to get people who are caregivers and beyond to think about vaccines and other steps that are available to keep them healthy and going in the right health direction, if you will. And I think that's also important
Right.
for legislation. Um, I think we struggled a little bit with the pandemic and the vaccine and all of that business. So share a little bit um, with that
Yeah.
regard.
So I spend a lot of time on this because we do track nursing homes and how they're doing across the country and making sure that residents are getting their up-to-date vaccines and staff are getting, because it's so important. We know that there were so many problems in nursing homes across the country, not only in Ohio, but across the country. So what can we do to prevent it? Well, you get vaccinated is what you do. And then if you do get, they used to call it a breakthrough infection, that you get treated because now we have treatments.
Yes.
So it is time to get
Yes.
your vaccine. There's up-to-date vaccines that treat more of the different strains that are out there, as well as the flu vaccine, and you can get them at the same time. So it's important to take care of yourself. Like we always say, put your oxygen on first, right? And
Yes.
as well as making sure the
Yes.
person you're caring for is getting the same. And it's really the simplest thing you could do. I mean, it's not that simple, right? I mean, you are putting something in your arm and you might have a little pain there and you might feel a little funky the next day or something, but it's like 94% effective that you are not going to have to go to the hospital. Staying out of a hospital is a good idea unless you absolutely need a hospital. Stay home if you possibly can.
Yeah.
Yeah, I don't think people realize it's this, like becoming a caregiver, all of a sudden it could happen overnight, right? We don't expect it sometimes we do. And just that, like you're saying, this little bit of preparedness now for what it could mean for people is one step. You know, like we were going to talk about some of these resources that are available for people. It's almost like we always need to do a little bit of this pre-planning and thinking about ourselves as caregivers any day of the week for anybody that we know. I mean, even our coworkers, quite frankly, you know. Is that really
And
where
you
you
know,
would start? Is like that self-care?
it's the self-care, and it's like really thinking about trying to stay healthy, as you just said. What can you possibly do? We know that this is the third winter season that we are entering because people start going indoors. You know the story. You hear about it in the news all the time,
Right.
that you're more likely anyway, before there was anything like this, to get the flu or to get very bad colds and things like that. So what can you do? Positive things we learned from the pandemic is that we do have masks, right? So if you're going to be in a crowded space, I still wear a mask when I go food shopping. I just do, or any place I'm in, like a train. I take trains a lot, right? It is, you know, it's a simple thing to do to cut down your risk of getting not just COVID, but the flu or these other respiratory illnesses. I mean, anything you can do to stay well is a good thing to do.
Yeah. I have a friend who's really struggling. She needs home care. And it's been difficult to advise her because I'm not a family member. And I keep trying to figure out how to encourage her to do a little research on her own about services that may be available to her. But to be quite frank, there's so much information out there. It's such a huge topic that I'm struggling with how best to advise her, encourage her, assist her.
You know what? I may have another person who's going to join us here that may be able to help Susan with some of these additional resources. Tonight, another guest that we have with us is Amy Goyer. And Amy is the author of Juggling Life, Work, and Caregiving. She serves as AARP's National Family and Caregiving Expert, a passionate champion for caregivers. She's been one her entire life. She's cared for her grandparents, her parents, her sister, and others. She's got more than 35 years of experience working in the field of aging, and she's a certified aging in place specialist. She shares her personal caregiving journey as well as practical, actionable tips for caregivers in her columns and videos. She's a nationally recognized expert and sought-after speaker, and Amy moderates AARP's Facebook Family Caregivers Discussion Group. She started her career as a music therapist and adult day services administrator in Columbus, Ohio, and later worked at the Ohio Department of Aging before joining AARP, where for 15 years she led the intergenerational and grandparenting programs. A widely quoted media authority, Amy has been a recurring guest on NBC's Today. And guys, she was on there this morning. So welcome, Amy. And maybe you could join our conversation with us. We're just about to get into some of these resources and some of the things people really need to start. You know, we were talking about self-care and getting vaccines and all that kind of stuff. And, you know, where else do you think we should start?
Well, I want to say something before you start, Amy. I had the opportunity to see you this morning. And I'm a big Today fan, so it would have been odd for me to miss you. I wondered what you came away with in terms of whether people approached you after that or...
Yeah, it was. In fact, I'm sorry to be late. My flight from New York was late, and I literally ran off the plane and jumped in. My boyfriend picked me up and ran into the house and joined you. So I'm so sorry to be a few minutes
Okay,
late.
just glad you're here. Just glad you're here.
I'm glad to be here. But yeah, so you may have heard in the segment I was talking about documents and various things that you need to have in place. Can you hear me?
Yeah, I can hear you.
Are you having a hard time, Susan?
Really?
Susan can't hear me.
Yeah.
Okay.
I don't hear her.
But the rest of you can hear me?
Yes.
Yep.
How
Okay.
do I do that?
All right, I'll keep talking then.
How do I refresh my page?
So I was talking about the various things you
How do
need
I
to
do
have
that?
in place. And I mentioned the AARP's Family Caregiver Discussion Group on Facebook, because that's a place I said, you know, one of the best things you can ever do is ask other caregivers, what did you need? What has come up that you didn't think you'd need as a caregiver?
Yes.
And I mentioned that group, and we within an hour had I think 300 or 400 new members in that group. So a lot of people took action immediately, and I helped kind of approve some of them afterwards. And folks were saying, you know, I'm caring for my mom, I'm caring for my spouse, I'm caring for an aunt or an uncle, and I need help knowing what I need to do, how to get prepared, and what to get together. So I think that's really, you know, it really tells us how important this is to so many people. And I'm just really grateful to have that opportunity to help get the word out about AARP's great resources.
So talk a little bit about the resources for our audience here tonight.
Sure. Yes. So first of all, I talked about, you know, the legal documents you need to have in place, and a power of attorney for finance that helps you with managing your loved ones' banking, their financial matters, their property, and their legal matters. And then one of the things I shared, and that I think you all may have stories about too, is that sometimes when you have a power of attorney, it doesn't necessarily work for everything. And what I found was, for example, my parents had a living trust, and when they sold a property, our farm in Athens, Ohio, it was in the living trust, and so the check was made out to the trust, and they did not know they needed to have a checking account for the trust alone. And even though I had their power of attorney, I was on all of their accounts at that bank, I was not allowed to open that account for them, for the living trust. I was even a trustee in the trust, and the bank would not allow me to do that. And my lawyers talked to their lawyers and everything, but in the end, my mom had to end up signing, 20 signatures when she'd had a stroke, which was really hard for her. Yes. So I also found that sometimes some financial institutions, like investment accounts, things like that, will have their own paperwork that they want you to fill out, and want, to give others permission to deal with your accounts. And of course, we all know too that the Social Security has a representative payee process that they set up for people who can't manage their Social Security benefits. And the VA has a fiduciary agent process that they set up. I had to go through that for my dad. So sometimes you think you've got everything in place, and then there's something that, it doesn't cover.
Ernest,
go ahead.
Last night we did a family caregiver award ceremony, and it was absolutely amazing. But I think the thing that really struck me was when the family was talking about their experience, what they said was, at the beginning we were lost, so we're talking about finances, and I understand they have to do that. And we started out with, first we have to take care of ourselves and make sure that every day we're prepared, we get our vaccines and we take care of ourselves. And it's like, these people felt so lost, and it probably took them, I'm just guessing from the conversation, over a year before they found resources. And what I'd like to leave our folks with is the idea that they need to be educated. We need to help educate them that the resources are already there, that when they're in this situation, when they ever have to take care of anybody, that they are there, and what they are. And where should they start? Like, where does this conversation start even?
Yeah, that the important conversations are one of the key things that AARP covers in our caregiving guides, that to talk with their loved ones about what their wishes are, about how they would want them to manage their finances, their healthcare, and those things if they're unable to do so. And to talk about these things early and often, because things change, and it's also much easier to talk about it when you're not in a crisis. You just don't want to wait until you're in a crisis, and that's just a nightmare for everyone involved. AARP has some other great resources. For example, we have free copies of advanced directive forms for every state on the AARP website, and you don't have to have an attorney to fill out those advanced directives. And you may need to have a witness or a notary, and you can just go to aarp.org/caregiving, and you'll see a link there to click on those. So those are things you can do. We have a lot of checklists. What am I going to need? What's the paperwork I need? How to put together a medication list of your loved ones and a medical history, and what's the difference between a power of attorney for healthcare and a power of attorney for finances, and all of those kinds of really specific things that are needed. You know what? I always send people, and I'm sure you do too, Susan, to the area agencies on aging. Yes. Because they really are, the first place to go and find out what services are available in your area. I know you were talking about that. And also what resources you have locally.
Yes, I'm sorry. I was trying to see if we had any questions from our audience, but I can't tell. Anyway, before you joined us, Amy, we were also talking about policies and policy development and concerns that should be presented for policy construction, if you will. Can we go back to that a bit, Susan, and continue that conversation?
Sure. Be happy to. So, like for example, I mentioned we had in the country, we have about 50 million family caregivers, and half of them are doing what I call complex care. You could call it a lot of other things, but you are definitely giving medications and not one pill. You're doing a lot of different things. You may be doing wound care and oxygen and definitely special diets, which I used to think was pretty simple, but it's not simple. It's expensive. You have to find it, and you worry, and then the person you're working with is like, I don't like that food. I want this food, So there's lots of things that are going on. So there's a couple of things we did. One was to do research around this, and then we updated it not too long ago, which helps have information. As I was saying, stories are better, but it's good to have data too, to like push this. And the state of Ohio is one of 45 states and territories that passed the CARE Act. And the CARE Act is very simple. It's like if you go in the hospital, you have to be asked whether you have anyone who's taking care of you, who's going to help you when you go home. They don't even say caregiver, just somebody who's going to be helping you. They don't go into like doing what, just someone who's going to be helping you. And then if that person says yes, they have to ask you, well, would you like that person's name in the medical record?
Right.
So then, because then do you want them involved in your care? Right. This is really very, very good. And then we need to tell you as soon as we can when they're going to be discharged. But more than that, we need to offer training, education, support for the things that you're going to do before you leave. Let's make sure you know, and a number to call after you leave. So Ohio passed that. I mean, I'm very impressed. That's important. And now we've got to make sure that it's actually happening. So we keep going back. Is this really happening in your state?
Yes.
So you have a right. You have a right to ask for that. It's actually very important to advocate for yourself, because there's so much going on. I'm right. There's so much going on. It's like, oh, where did I park the car? Right. How am I going to get him home? How am I going to get him up the stairs?
Right.
Right. I'm glad you brought that up, because as we volunteer, we often tell people about the CARE Act and provide that card for them. And that's a long conversation sometimes, because they're like,
that's
what?
Great.
But I'm glad it's there. I'm sorry. Was someone else asking a question? Because I was about to go to another topic that I'm personally interested in, and that's I am a grandmother. I love my grandchildren. I had full responsibility for them for 5 years. I was lucky. It was not a financial burden. It was a new day. But I do have concern about people who are forced to take care of their grandchildren without the appropriate resources to do so. And I wonder how many states, and if Ohio is one of them, that really supports that grandparent action. Can either of you?
Well, I can speak. I have some history in working with these what we call grand families. So many times it might be grandparents, might be aunts and uncles, siblings, cousins. Sometimes they're just close family friends that don't have a blood or not a blood relative. And many states do put effort. I'm not as familiar right now with up to date with what Ohio is doing, but there are many states that have part of the National Family Caregiver Support Program funds can be used to support grand families if they choose to. There are programs that are kinship navigator programs that can help grandparents and other relatives find these resources you're talking about.
Where did they go to? Like, where do they go to get the funding? Like, how do they know that they can be funded?
So and Susan, you may want to speak to the National Family Caregiver Support Program more from the policy viewpoint, but essentially there's a choice to use a certain amount of it if they want to for grand families. Many of them don't because there's not enough money to go around, for all caregivers. That's really unfortunate. It really needs to be more. But the states have that option to decide how they're going to channel their funds. Susan, do you want to add anything to that?
Is it like through the AAAs or is it through the?
But this is another advocacy point.
Okay.
Good.
It can come through the AAAs.
Well, the AAA should
know. Having trouble hearing.
But I was just going to say this is another thing.
Go ahead.
I was going to say this is another place to advocate, as you were saying earlier.
Yeah.
Can you hear me?
Now
your feed is a little rough. Yeah, your feed is a little rough.
You're in and out. So try it again. Technology.
I don't know what to do.
Try it again.
That's all right. I'll just pass.
Okay.
Well, I think what Susan was going to say is that this is a chance to advocate and to support these really important programs that we need on every level. If you are a grandparent and another relative caregiving for a child, then definitely reach out to your area agency on aging. They tend to know, even if they aren't offering something specifically, they tend to know who is in the area. Sometimes through the child welfare systems, they have various support groups and programs like that. There's a national organization called Generations United that does a lot of work around grand families, and they have a great deal of resources. So go to the gu.org website and check out there as well. We do have on the AARP website, I wrote a guide years ago for grandparents raising grandchildren. So if you just do a Google search for AARP grand families, you'll find that.
Okay. I looked for that, but I was saying grandparents. Maybe I did not find it. So that's good to know. That is very good to know. Okay. So I don't know. I guess I'm anxious for each of you to just start to tell us what we have not asked that you feel is important for us to know and for our audience.
As we're teaching it, as we're advocating for it, as people are trying to understand it, where and what and where do we begin and how do we continue our journey? And let us have it.
Susan, do you want to try again to see if you can be heard?
How's that? I tried to switch a different internet service.
Yeah.
Is that better?
That's better. Yes.
Oh, good. I didn't hear your question, but now you can hear me at least.
You want to repeat your question?
What was your question?
I think it's more free form for you to let us know what is the knowledge that you want us to have, and what is the knowledge that you wish your that everybody in the country knew? Like, if we could tell them what to do, and or resources or anything, like, what would you say to them? What would you say to us?
Well, I think there are the very basic, like, you need to plan as you know, first of all, people become family caregivers in various ways, neighbors,
Yes.
friends, family members.
Yes.
It could be very sudden, as you said earlier. So it's hard to plan if it's very sudden. You didn't know this was going to happen. But many times it does happen with a little bit more warning, that you see some signs and symptoms that there might be. But I hope that's not me. even if you're not, faced with something immediate or something, it's good to just talk to each other as time goes on. I have to tell you, my own family, I will say to them, and of course it drives them crazy, right? But they're used to me now. Like, listen, if there's a time that I don't know who you are, it's okay. Don't worry about it. I'll be fine. Things like that. But if you're worried about how I'm driving, you need to know. And they humor me, right? Because they're used to this thing. But it's not a bad idea to have those sort of playful, almost initially. Things change over time, and let's just talk about what would happen over time. And I think that's a good thing in general, if you can have those communications. I know Amy would agree. Thanksgiving is a great time for those. We always say that Thanksgiving, Christmas or holidays, kind of in general. You're around the kitchen table. Don't talk politics, talk family, right? and start to plan. I think it's important to talk to your siblings or other relatives. Like, are we going to be in this together? To start to think about. People don't want to think ahead.
Yeah.
But the more you do, the better shape you're going to be.
I think that's so true. No one wants to think that it's impending, which again is why I think it's so much easier to talk about when it's off in the distance. When a time comes that, I can't drive anymore or things change, let's talk about what the options will be. And I think that is one of the hard things, that people don't know what the options are. So I would really advise folks to just, AARP has great state caregiver resource guides. I know you have one for Ohio. Yeah. There's one for every state, and that's at aarp.org/caregiver resource guides. And that's a good place to start, because it's at actual phone numbers you can call and that sort of thing, and tells you about any special programs there are in your state, like a respite voucher program, for example, that will give you some help when you need it sometimes. I also think, again, I tell people, call the Area Agency on Aging and just say, I just want to know what you're all about and what's offered. And sometimes they have local caregiving events, like a caregiving conference or something like that, and go to those, even if you're not caregiving yet. And then you'll get an idea of what supports are available, from adult day services centers to what kind of in-home supports are there. Remember that the vast majority of people are cared for at home. So that's why it's so important to know what those community resources are that are going to be available to you in where your loved one lives or where you live.
Yeah. We do have a question. Yeah, from one of our participants is asking, you were saying about having those conversations at Thanksgiving or Christmas, and they're like, well, how do you talk to a domineering, stubborn person who shuts down, every time you have one of those conversations, like every single time, and we all have those relatives. We all have those relatives. And that can be the hardest thing is when it comes that way. I've often found for a lot of people, an indirect approach is a better way to start it. So you can talk about, I saw this thing on TV. I read this article. I watched this webinar. I was talking to a friend and this happened to her mother. What would you want if that happened to you? Or how do you have any plans in place if something like that happened? Or, any kind of other people examples can make it not quite so personal, and yet you can start the conversation that way. I think it's really important too to think about who should be a part of the conversation. Sometimes
people are more comfortable talking about certain things with certain family members, or, my grandmother always had to have my uncle part of any discussion that was around medical stuff because he was a health teacher in high school.
Yes.
So even though it doesn't make sense,
Right.
if that made her comfortable, that's what matters,
Yeah.
That's right.
And also sometimes it's easier to have that conversation with the doctor or the lawyer or the accountant. I do think that you have to respect boundaries, etc. But if a loved one really refuses to talk with you about their plans, say, okay, just let me know who I should contact if something happens to you.
Yeah.
Because
and
who's your accountant, who's your lawyer? I hope that you're taking care of these things. Here's a list of things that maybe you should think about doing, and then try to soft approaches like that and bringing it up. Short conversation. You're not going to talk about all of it in one conversation. Nobody wants to do that. So, little bits here and there. And that indirect approach often works. But some people, some people don't like the indirect approach.
And
Amy, right. Go ahead, Susan. Were you trying to ask a question?
Some of these guides trying to say to Amy, I think some of these guides you talked about earlier actually go through this, don't they?
Yes.
They say, here's some examples.
Yes. We have a whole in the AARP caregiving guides at aarp.org/prepare to care. We have several different versions of these guides, and there's English, there's Chinese, there's English for Asian Americans, there's LGBTQ, veterans and military caregivers version, Spanish, and the first chapter is about these conversations, and it gives some tips on how to have them, what the topics should be, when to have them, and they are really a great guide for the conversations.
I think before you joined us, one of the things that we were struggling with is how large, how big, how huge this conversation around caregiving is. And I think about the fact that people step into it in different ways. It may be an accident. It may be dementia. It may be aging. There are just so many different avenues to becoming a family caregiver. And I think that's part of why it makes it difficult for people to listen and take the step to be prepared. I'm not sure what you do about that, except tell them there's information and keep raising the question, keep it in front of them.
I hear this a lot from the Facebook group members that many people don't even ever post in the group, but they read everything. And so they learn from what someone else is going through, because you don't know how yours or your loved one's health is going to unfold over the years. You can't, and I think, Susan, you said this, you can't plan for every little thing, but there are certain things you can kind of plan for and put in place. And just to know, well, if this comes up, how do I deal with that? And how have others gotten through it?
Yeah. So one of the things, go ahead. I was just going to mention the fact that these resources that you're talking about, Susan, are also, I guess, in the resources tab of this event. So people don't have to go hunting and trying to find them, that we've made them available for them in the resources tab, so they can just get them this evening if they'd like to see where they are.
Yeah.
Excellent.
So in that, do you have the AARP Ohio caregiver resources in there? Because we have very specific.
Yeah, we have
Ohio
guide. Yeah.
Well, if we don't, I will make sure that we either can or we can get it to people, who are on here. Absolutely.
Let us know. We can definitely do that. Let me see.
And again, if you're listening from another state, just go to aarp.org/caregiver resource guides.
Yep.
And you'll have a guide for your state too.
Okay. And how do you deal with the, so it's probably in the guide too, but I'm going to admit that I have not read the guide yet. Okay. Shamefully. And as you're learning to prepare for everything in life, right? How do you deal with the kids that don't want to hear it? So you try to, like Susan, you were saying, playfully, you're killing your kids with it. But I'm in the same boat. Like every time you bring it up, whether it's planning for, end of life experiences or old age or anywhere, they're like, Mom, we don't want to talk about this, especially at the holiday table, And so eventually what I don't want to have happen is, like you were saying, an unexpected something, and it could happen to anybody at any age. Then all of a sudden they're not prepared at all because they never wanted to have the conversation.
That's so true.
Right.
And you're right. Some families, the holiday table is not the time, it's more the time to kind of assess the situation, but maybe you don't want to have the conversation, but you can set up a time to have the conversation. So you're all together and you're going to say, okay, next month, let's do a Zoom call and we're going to talk about this, and set the stage. I think, what you said about, the kids don't want to hear it because it's scary for them. They don't want to ever think of a time when they're not going to be around, right?
Yeah,
but
right.
I mean, as a child of my parents, I was so grateful that we had those conversations.
Yeah.
And I just encourage people out there who are potential caregivers someday to think about that it makes it easier for you, and just, realize that you're not talking about something that's going to happen tomorrow. That if you talk about it early enough, you don't have to be scared of it.
Yeah. Well,
Right.
I found that writing a will is very helpful because you should have a will. Right?
yeah.
It's not a terrible thing to bring up, but it did mean that we had to talk about, well, who would be in charge of the financial part of this? Who would make medical decisions? And just have that conversation so they would know. I appreciated that. My father did that. I mean, I'm one of 6 children, so it can go the other way around. Like, which one's in charge?
Yeah. It's taking care of it crazy, right?
Too many people, right? So we were able to figure that out ahead of time. Who was the one that was going to deal with this? Who was going to deal with that?
Yeah,
and I just found that very helpful. And my children have accepted that part. That this is one of the things I think you have to write down. Like, what are the passwords to everything? Like, how do you find any of these documents that you're going to be needing? There has to be something you write it down and tell them if you ever need this, it's in the Bible. That's where ours is, by the way. Don't tell anyone.
Passwords to your password manager. And there is even a digital power of attorney that you can set up. So people can manage all your online accounts and all of that.
I think part of it is also easing into it. I have started to ask my daughter to go to the doctor with me. And what I said to her is sometimes he starts talking to me and he'll say something and my mind stops on that one thing. So I don't really hear the next part that I should. And she's been doing that. And it's been helpful for both of us. I mean, I'm in reasonably good health, but still you get in the habit and then it won't be.
Then it won't be strange if you need it. And I hope she's taking notes or you're taking notes and keeping those track, somewhere. And that's one thing where technology comes in. I love what technology can do for caregiving because you can have, like, I would take notes on my phone in Evernote, and then that synchronizes on my computer, and I can send that note to my sisters immediately. And, you can have it on multiple devices. There are things where if your kids won't talk to you about this stuff, at least you could use an app or someplace on your computer, set up all of your wishes and everything in one place, and give them access to that. So if and when they need it, it's there.
Yeah, that's great.
I just learned how to ask. I got to tell you guys this one because I thought it was so cool. I just learned about this week, and this is a company in Indiana who is taking, how you have all those portals, all those healthcare portals.
Yes.
I've got one for every doctor, I think. They're never all the same. And this app will take all that information and put it in one place for you, including your Medicare records.
Okay.
And so it's like it creates almost like a medical history ongoing in a place where you can have all that information in one place.
What's the app?
Keep looking. I just met this woman a couple of days ago. I don't remember the name of it.
Okay. No pressure.
If you do a search for, app that consolidates your healthcare records, I'm sure you'll find it.
Okay. And the participant who had asked, the question about the stubborn parent also said that they are working through her doctor now. And it does seem to be chipping away at the stone, at that little surface. So like you said before, she found a beginning point, someplace to start, like, getting into the crevice, and maybe it'll open up the chasm for her.
That's a great way to describe it. for sure. I think I thought of it. It's called Primary Record, I think. Look for that.
Okay.
I'm not
Yeah,
endorsing
no pressure
that
though.
product. I'm only sharing with you something I learned.
Yeah, no, that's absolutely amazing because you know so much more than we do. I think if there's any more questions out there, and I'm asking our people who are helping us, if they have any more questions out there, we only have a couple more minutes, and I do want to make sure that we answer anybody that we, that would like to answer, ask a question of you guys.
If
But
not,
I
no
don't
questions
see.
from the
I know
audience.
I don't see them replying too
If
much.
not,
Go ahead.
well, if not, we've talked about different resources, and one that I really, really wanted to bring up, because I talked about it earlier about people doing these, I call it complex care, whatever you want to talk about it. We have put together videos. There's like 50 of them.
Yes.
And they're on our website, on the AARP.org website. And I'm just going to read you: pain management, preparing for a hospital stay, operating specialized medical equipment, special diets, managing incontinence, wound care, mobility, managing medications. All of these are available, and each one of those topics has like 7 or 8 different videos.
Yes.
They are often in Spanish, and they also have like source guides in many different languages. We've put them in many different languages. So we don't do a good job of getting them out there, but they are really helpful. And it's also an interview with family.
I think those are at AARP.org/no longer alone. Does that sound right? I think that's the
I viewed them the other day.
That's right. I think you put them in.
I just went in the portal and found them. So
they're really, really helpful. I send
available.
caregivers to those videos all the time. And, incontinence, for example.
Yeah.
Who talks about incontinence? But
no one wants to talk about that. No one
have to deal with. It's one of the most common topics on our Facebook group.
Yep,
so it's so nice that we have actual videos and, things that are in practical ways helpful like that.
Yeah, and it does look like those the things that you were talking about, Susan, are in the resources that we have posted. Yeah. So all those things are there with the videos.
That's why I just wanted to bring it up.
Yeah.
I just want to bring it up because you put it in there, and they're often just not known, and it can be very helpful. I mean, just for example, in incontinence, people will think that they need to get the product that has 4 stars, I guess you would say, like that's the best to do, but it's often not the best to do.
Yeah.
If you really, I mean, I won't get into it now, but things to learn about managing, because they're the most expensive, but they may not be the best ones for you to be using.
Right.
Yeah. So nobody talks about these things, and it's like one of the most important things that people deal with.
Well, they seem basic, and they're a necessity, and they're those ADLs, those activities of daily living that we all have to deal with. But they are things like who wants to talk about bathroom habits and incontinence and having to clean, take care of and clean up another adult person, and especially when it's so personal, like your mother. That seems like an invasion of their privacy, and they get shy about those things too. And it's just, nobody wants to talk about it. It is there, but it really gets very, very personal because it really gets into your space.
But it's very necessary when you get to that point. I've been there.
It's one of the most common caregiving tasks.
Right. And we are just about
how to talk to someone.
Yeah, this has been great.
Talking over each other.
I mean,
we are getting close.
One more resource that I absolutely love that AARP's, and that's the Home Fit Guide.
Yes,
and that's the guide that you can go around and go through the home and make sure that it's safe. You can do easy modifications all the way to more complicated ones. And it's AARP.org/homefit because we talk about fall prevention and safety and usability, and I just think it's one of my favorite resoases.
One of my favorite as well. We use it a lot. Our team does, as a matter of fact. So it's good. It's great. Okay.
So ladies, I'm going to wrap up a little bit here because we're running out of time, although we could probably talk for hours. But this has been a very, very informative discussion. And thank you, Amy, for running from the airport. It was much appreciated.
I'm glad I made it. It's great to
I know.
spend time
And
with all of
Susan,
you.
just fighting through all your technology challenges, just hanging out there with us. It's
gosh.
very appreciated.
We're
And
determined.
thanks for our members and our volunteers and listeners for participating in the discussion. And as we kind of wrap up this event, AARP thanks all of you so much for joining our caregiving and LTSS long-term supports and services conversation this evening. And again, thank you guys for taking times out of your super busy schedules. AARP also is excited to share a new option for getting information to family caregivers who are who have loved ones in nursing homes, and they can text CARE to 22777, and you will receive information on installing a camera in your loved one's nursing room home. I hope people take advantage of that opportunity just to be able to do that if they're in that situation. So if you have additional questions, again, we have all those resources to go to at aarp.org/Ohio, where you'll find a whole bunch of stuff. The information and the conversation that we have today has been recorded and will be found immediately, I guess, on our YouTube page following this presentation. We hope that you guys learned something that you can keep, with you and share with your loved ones. And we hope that you're all healthy and safe as we go into this holiday season. Thank you all very much, and have a great evening. Thank you, guys.
Evening. Yeah, thank you.